I will allow our colleague Jelte Helfferich in Groningen, Netherlands, to give us the European view of what is going on in Europe. Jelte?
Yes, thank you, Carlos. Let me share my screen also. So, well, thank you for inviting me again to this working group meeting. It was great to be here. And Carlos asked me to tell you a bit about AFM, enterovirus D68, and also other respiratory viruses in Europe. I'm a neurologist and other virologist or infectiologist, so I'll try to do my best to tell a bit about virology as well. And I had some input from my colleagues who are virologists in the Netherlands at the Dutch CDC, to put it like that. Before telling a bit about the situation, I want to thank the colleagues at Johns Hopkins and at the Kennedy Krieger Institute, and also in the Children's Hospital of Colorado, for the hospitality 1 month ago when I was able to visit you over there and to learn a lot from you. It was a truly inspiring trip. Put some pictures over here, but it was great to be there, and I've learned a lot from it. Well, when I tell a bit about enterovirus D68 in Europe, I will start by again mentioning NPEN. I think most of you will know NPEN, the European Non-Polio Enterovirus Network, which is a network which started mostly from virologists, microbiologists, and also public health people, and which had the goal to, well, different goals basically, but mostly to look at enteroviruses in Europe, to look at enterovirus-associated respiratory infections, neurological infections, hand, foot, mouth disease, and also to look at seroprevalence surveillance. And I think this is a great network that has been able to look at enterovirus D68 in Europe, and the data that I will share is mostly from this network. Since about a year, we as neurologists got involved in the NPEN network, also to look at AFM, and I want to tell a bit more about that later as well. So I think in March I shared a little bit about enterovirus D68 before 2021 until October 2021, and this is actually an update from 2021. So what happened in Europe after October in 2021, and we saw an increase in enterovirus D68. What you see over here is the number of tested samples in October till December in 2021 in different countries. And this was after the ease of lockdown measures, that more samples were tested, and that also more of the samples were enterovirus positive, and a lot of them were enterovirus D68 positive, 0 to 28%, which was an increase from before. And if you look at the numbers of enterovirus D68 in Europe in 2021, then you can see that after the report that was published in Eurosurveillance in October, I think in 2021, that there was ongoing circulation of enterovirus D68 with a big peak in October until December, going down until January in different countries in Europe. So a lot of enterovirus D68 circulation, which, and I think some enterovirus D68 was also seen in the US, but not as much as in Europe. And most of these were young children with respiratory disease, but with also 5 cases of AFM were reported within this group. But this is truly an underreporting of the AFM case in Europe, because we already had 4 cases of AFM in the Netherlands, for example. If we look at enterovirus D68 2021 until the beginning of 2022, then you see, I think, well, a lot of the same increased periods of rotation to the US, so 2014, 2016, and 2018. Then we had some increased rotation in end of 2019, and then to 2021, a big peak actually, which is mostly from detected by the NPEN network. So after 2021, and that was the question that Carlos asked. Did we see enterovirus D68? Well, yes, we did in different countries from July until October 2022, similar to what was reported by Sarah earlier. So in the Scandinavian countries, but also in Southern Europe and in Europe and Germany. In the Netherlands, we did not see too much D68 circulation actually, and these are all the countries that reported an increase of respiratory disease with enterovirus D68. So those are the orange countries, and the yellow countries are where they did see some enterovirus D68, but not a huge increase, similar to the end of 2021. Mostly these were children, in most cases hospitalized with severe respiratory symptoms, and only limited case of AFM, which we'll come back to later. Because if we look at AFM in Europe, unfortunately, we do not have the surveillance that's performed by the CDC in the Netherlands. So basically, what is reported on AFM in Europe is based on case series. If you look at the different peaks that I showed before, so in 2014 we had a peak of enterovirus D68 and 3 cases of AFM were reported in literature. 2016 where 39 cases were reported, and in 2018 67 from different countries, but this is an underreporting as it's our case series just from single countries mostly. In 2021, we had, we're just starting to build the European AFM network, and then we saw 20 cases of AFM through this network. If we look now in the past months in Europe, then here is the map of the enterovirus D68 circulation, and this is what was reported through the European AFM network. And you see that there are sporadic cases across Europe, including 1 in the Netherlands, 2 in Sweden, 3 in France, and 3 in Austria. So sporadic cases spread across Europe, and we had 2 cases in which enterovirus D68 was shown. So as I mentioned, we are hoping to have a more organized way of finding AFM cases in Europe. And we are trying to do that by this AFM network, which is currently emerging. We have now 20 clinicians from 20 countries in Europe who are interested to participate, and we'll soon have a first meeting to see how we can create some kind of AFM registry in Europe. And also this network will create a form of expertise, and also we will be able to circulate information on new cases and new outbreaks, as was done recently when we saw increased enterovirus D68 circulation. I think it's great that we are able to exchange information also with the AFM working group within NPEN. Well, last slide is on other respiratory viruses, which, well, you saw a big increase in the US in the past months and a lot of ICU admissions. In the Netherlands, we did not see a big peak of respiratory illness. As you can see over here, this is 2021, which you saw a big peak over here, and this is 2022, so not too much going on at this point. And if we look at RS virus, which was also a driver of the increase of respiratory disease in the US, then you can see that in the Netherlands, at least, we do not see a lot of rotation. In 2021, which is the black line over here, we did see a strange peak in the summer with a lot of RS virus and a lot of ICU admissions, which is well, very strange, as we normally see RS virus in the winter months. But not this year yet. If you look in Europe, and this is data from the ECDC, which is online, publicly available, then you can see the different peaks of RS virus circulation. This is again 2021. This is the peak that is also shown in the graph from the Netherlands. You can see that there is some increased rotation in the past months, and especially in Denmark, there were a lot of cases of RS virus. So there's something going on, but not as much as in the US. There's some people that I want to thank for the data, also the virological data, and well, that's what I wanted to share.
Thank you so much, Jelte, for that update and information. Don't know if there are questions for Jelte now.
Your slide where you showed like how many cases of AFM, the 11 cases or whatever. So are those people that were just in your network of like 70 hospitals, or I think that was the number I recall, or is that just, cases reported to European CDC sites that then you've collated?
Yeah, so like I said, unfortunately, the European CDC sites do not have an organized surveillance system for AFM cases. So these 11 cases were reported through the European AFM network that we are currently organizing, in which we have involved clinicians. So we hope to have it a bit more organized, as the ECDC is not as much involved as the CDC.
Sure. Well, cool. Good luck on the efforts.
Thank you.
Piggyback a little bit on Matt's question. So just to follow up on that, so is the thinking at this point that the levels of D68 and AFM that are seen more in Western Europe are more related to where the sites are than anything else that's specific to those areas? Is that what I'm hearing?
I'm not completely sure. So what do you mean exactly?
Well, so it just looks like most of the D68 cases are on Western Europe, right? I think, I mean, just from a quick glance, it looked like France, the UK, Spain. So is that more because that's where the sites that are screening for D68, or is it because the geographic or the population?
No, I think you're right. It's more that in Eastern Europe, there's less screen for enterovirus D68, so we have less data, and usually it takes a bit longer before we get the data from these countries as well. So maybe we, in a couple of months, we will have data from those countries as well. Yeah, and also from the AFM cases, we get more information from Western Europe than from Eastern Europe.